A healthy diet is an essential part of diabetes management, helping to control blood glucose levels and achieve a healthy weight. It is important that dietary advice is tailored to your individual needs and is specific to your type of diabetes. In type 1 diabetes, in combination with a healthy diet, you may be taught how to use a carbohydrate counting system to allow more flexibility in eating by matching your mealtime insulin with the carbohydrate eaten. Your diabetes specialist will discuss this in detail with you. In type 2 diabetes, we recommend a balanced healthy diet which includes low glycemic index carbohydrates. The diet recommended for people with diabetes is suitable for the whole family. Some people will be trying to lose weight. Others will be trying to maintain their current weight. The following diagrams show the proportion of each food group in a typical meal, depending on your circumstances. In the following sections, we will talk in more detail about various parts of a healthy diet. Carbohydrates include both starchy foods and sugary foods. All carbohydrates will have an effect on your blood glucose level, even if they do not taste sweet. All carbohydrate foods are broken down into glucose by the body. Some carbohydrates are broken down slowly, others quickly. The speed at which they are broken down is known as the glycemic index. The quantity of carbohydrate eaten and the glycemic index will determine the effect on your blood glucose levels after food. Carbohydrate foods include breads, cereals, flour, pasta, rice, couscous, potatoes, crackers. Some vegetables and legumes such as peas, sweet corn, sweet potato, lentils, pulses, fruit, fruit juice, and dairy products, cakes, biscuits, honey, sweets, chocolate, fizzy drinks, cordial. Most carbohydrate foods have now been tested for their glycemic index, or GI. The glycemic index of a food can help inform you how quickly the glucose in the carbohydrate is released and the effect it will have on your blood glucose levels. People with type 2 diabetes are recommended to try and choose carbohydrates with a low to medium GI, less than 55. The speed that your blood glucose level rises is slower with these foods than with foods with a high GI. Low GI foods can also aid weight loss, keep your blood glucose levels within the recommended limits, and reduce your cholesterol. High glycemic index foods are useful for treating very low blood glucose levels, known as hypoglycemia. This is because you need to increase your blood glucose quickly. Some examples of low, medium, and high glycemic index foods are high glycemic index, cornflakes, bagel, white bread, baked potato, watermelon, rice cakes, jasmine rice, table sugar. Medium glycemic index, muesli, granary or wholemeal bagel, rye bread, sweet potato, banana, basmati rice, milk chocolate, honey. Low glycemic index, porridge, cholent mix, dried apricots, cherries, yogurt, noodles, dark chocolate, fructose. Most fruit, dairy and soya products have low glycemic index. They make excellent snacks or the basis for a dessert and are full of vitamins and minerals essential for health. Other foods which have a low glycemic index, such as plain chocolate and ice cream, can be high in fat. These foods should be eaten with caution, as they have little or no nutritional benefit and are high in calories. Keep them for special occasions or for a treat. Some carbohydrates can be substituted to reduce the number of calories and the effect on blood glucose levels. Some examples are: substitute table sugar for granulated sweetener. Switch fizzy drinks and cordials for diet or no added sugar versions. Try whole grain or granary bread instead of breads with fine refined flour. Try to reduce cakes, biscuits, crisps, and instead try fruit or yogurt for snacks. Some fats are essential for a balanced diet, but much of the fat that we consume is not needed for our health. Eating too many fats can cause weight gain, increase your cholesterol levels, and increase your risk of heart disease. Also, if you carry